Hello there, I'm Dr. Purnendu Roy. I'm a surgeon in Genesis Hospital, and yes, you have guessed it correct. I am here again to give an update of the present situation about coronavirus. All of you are completely flooded with information, statistics about how many cases globally, nationally, state-wise, in West Bengal, in Calcutta, how many positive, how many people have recovered, how many people have died. Now, I don't want you to be confused with these numbers. Today, I'm going to start off with, let's not all feel negative. We want to start with giving positive news. The good news is, two states in our country, Goa and Manipur, has already declared from 3rd of April there is not a single case of COVID, and so they have declared that these two places are COVID negative. Isn't that fantastic? Let's all talk about that. The Chief Minister from Tripura have said that yes, they have particular number of patients under surveillance and in isolation, but there is not a single case of COVID positive in the state of Tripura. What it basically means is that it's extremely important to understand that yes, we have accepted that it is a global emergency. Yes, we are all in lockdown situation, and someday lockdown will be over. Now, what is important is to change our mindset. And the only sunshine that we can think about is during this lockdown period not to give up, because if you don't give up, then there is no way that you can fail. And the song we should all be singing is "We Shall Overcome." One of the things that we must understand that what is bothering now, we are all stressed up with 1 month of lockdown inside our house. And because of this, it is causing irritability, anxiety, and the question is, when will it all this end? Now, there is a beautiful method of managing stress. It's called AMULET. No, it's not a jewelry. I'm talking about AMULET. If you apply this to any situation, let's start one by one. What's A? Accept what has happened. Like, we know that we have been hit by corona novel virus, which is COVID-19. So there is no point saying what will happen or not. Accept the reality. Next is M. Move towards the rational thinking. Let's try and be rational that yes, there are two places which have become COVID negative. We also know the fact that actually we can handle the situation, and if we try and see the mortality statistics, the number of people that are dying from COVID-19 is actually apparently looking so frightening, but people actually die much more in number from multi-drug resistant tuberculosis. The death rate is even higher with malaria and diarrhea. And just to let you know that the road traffic accident, the death, that is also so high in this country. Now, what all we can do, that's what is M, that is move towards a rational thinking. Next comes is U. Use restraint to think something positive out of it. Well, lockdown, nobody is going out, social distancing, people are staying at home. So what's positive out of it? So we need to try and rationalize what are the positive things that are happening. The nature is healing. The air pollution has gone down. All the birds and animals are now into a very normal space. Suspended particles are less. The pollution from the cars are down. So let's try and think what are the positive things that are happening during this lockdown period. L. What's L? Listen deeply what is bothering you. Now, when we were all working, we were complaining, so much work, no time, I want to do so many things, I have so many hobbies, not able to do so many things. What about the students? There is so much pressure, school, college, homework, exams and all. Everybody was complaining no time. Now, listen deeply. What exactly is bothering you now? Is it actually coronavirus what has happened, or is it bothering you that you are not able to go out? Why can't you try and again rationalize it by listening deeply what is bothering you? E. Encourage yourself to be compassionate to others. Think that you are in a much better situation than many other people. Be compassionate to the people who are daily wage earners, who are not able to get food. Think of doing something nice to help others, help somebody online. Like our trust, Genesis Education and Charitable Trust, has adopted 200 widows in Sundarban area, and we are supplying food and rations over there during this lockdown period. We are asking for people to come and give us help, because you know the dictum that there is much more happiness in giving rather than receiving. And the last is take some time off. T is take some time off. Play a game of chess with people who are there at home. Previously you never had time. So now there is enough time. You can spend time, plan, think, make it as a challenge at home. When did you last try out your hand in the kitchen? Go spend some time. I have been trying to do a little bit of cooking, making coffee, making aloo paratha, making cheese paratha and other things. Join with your family members together. Create some time. Take some time off. Now you have the time. Think positively. And this is what AMULET, AMULET. Be stress-free and be happy. The next question that I'm getting a lot, that is coronavirus really that different and that dangerous compared to flu, the common flu that we have? Now, novel coronavirus 19, that is the present virus that we have been attacked by. Now, there are many other varieties of coronavirus, and it's also a basically type of flu virus. Now, about 80% of the people who get corona positive, many of them might not even realize. They will just have asymptomatic, just a mild episode, and nothing will happen to them. It's only 20% of the people will develop more serious symptoms. And that too, the younger people handle it much better compared to elderly people and with comorbidity. So people who have diabetes, heart disease, hypertension or respiratory disease, and people above the age of 50 or 60, they tend to do it, they face it worse compared to the younger people. Now, so far globally, the death rate from corona is 3.4% of the people who get affected, and death rate from common flu virus is 1%. So it's not actually that frightening of that much amount of difference, that the death rate is far higher in multi-drug resistant tuberculosis. There is a lot being talked about food. Can it be transmitted by food? Many people have decided that can we eat egg, can I have chickens and things like that. It has been shown that the virus is more stable in frozen or in cold situations, and that's why there are certain recommendations like avoid frozen food, sausages or cold salad or cold cuts. Try and consume more fresh fruits, fresh vegetables, of course after cleaning it thoroughly. Another question which is very frequently being asked is, what will happen when lockdown is lifted and what are the guidelines for schools and colleges? There is very clear-cut UNICEF guidelines. Number one is all the students have to be informed and educated about how to protect themselves from COVID-19. They should be taught proper methods of sanitization, hand washing techniques, and they should be told about when to use mask or how much to use social distancing according to the advice given by WHO or our local health committee. There should be proper sanitization of the school building and proper cleaning of all the areas. And each time there should be somebody to whom these students can go whenever they are in doubt. Another frequent question that is asked is, are smokers more vulnerable or do they expose to higher risk of developing more severe conditions? Smokers already do have some amount of damage in their respiratory tract of the cilia, and there are lung damage existing. Now these people, when they get this COVID-19, and this affects fibrosis of the lungs, so they are likely to develop more severe respiratory. So those who are smokers, try and see if you can refrain from it. Maybe this is a good time. Maybe actually you're not able to go out and cigarettes are not available at the right time to give up smoking. The other thing that I wanted to say is, what is solidarity trial? WHO has started a trial in which try to find out the earliest they can, which is the best treatment modality, different drug treatment with conservative treatment as a trial in multiple countries to find out whether any of the drugs are actually giving better results. No point going into the details of those things, but it is already on, called Solidarity Trial, actually done by WHO to find as early as we can what should be the correct treatment. Talking about treatment, because the next question comes, what if I get COVID-19? Now let's make this clear that at the moment, whatever information, data and the researches are available, we still do not have any clear-cut treatment. There are talks about hydroxychloroquine as well as azithromycin, but WHO still do not recommend this as a standard method of treatment. Next comes vaccine. We know the human trial of the vaccine has already started, but it will take months before actually it is recommended that we can go in general for the mass population with the vaccine. So at the moment treatment is only symptomatic. The milder cases can be probably treated very easily. A little more serious cases, those who have pneumonia, acute respiratory distress syndrome, ARDS, lung problems or multi-organ failure will need to be managed in intensive care, and they are being done at the moment. But the summary of the whole thing is, it's actually not that gloomy. There are huge number of people, to the extent even people above the age of 80 and 90 who have recovered and gone home. So what my suggestion will be, keep yourself updated. See only proper websites, not that every social media. See the WHO recommended sites, see our national Indian government recommended sites, see the instructions they are giving. Keep a positive mind. Think of something new to do. Spend some lovely time with your family. People who are with small kids at home, they demand newer games every day. They're bored with the things that they have. Try and teach them newer skills. Show them origami. beautiful paper foldings, and you can create frogs, you can create birds, you can create so many things. Think of something nice. The only sunshine that we can think of is never ever to give up, because if we believe in ourselves, then only we'll be able to remain positive and fight. So the song should be, we shall overcome. If you like this video, please like, share and subscribe to my YouTube channel and ring the bell icon so that you keep getting notifications whenever such videos are uploaded. Thank you very much.